Hi listeners, welcome to the podcast series Proctology and Laparoscopic Surgery. This is Dr. Tripathy, Proctologist and Laparoscopic Surgeon from Bangalore. Today I will discuss few pertinent points about a very common condition, that is anal fissures. What is an anal fissure? An anal fissure, simply putting, is a cut or tear in the anal opening. It usually occurs at the junction of the outer skin and inner membrane of the anal canal. Sometimes these cuts can become deep enough to form an ulcer at the anal opening, exposing the underlying muscle tissue. It's a very common condition and can affect any age group. Now, how is an anal fissure caused? The commonest predisposing factor for causing an anal fissure is straining while passing large or hard stools. In other words, chronic constipation is the most important causative association for anal fissures. Even repeated bowel movements due to diarrhea can cause fissures. Other common causes include pregnancy and childbirth, reduced blood supply to the anorectal region, trauma during motions due to tight anal musculature, and many inflammatory bowel diseases and chronic infective conditions can also result in anal fissures. Now, how do the patients with anal fissures present? Typical history of a patient with anal fissure goes like this. They say, and I quote, "Doctor, I think I have piles issue. It was there before also, but I used to have discomfort or burning sensation after stools in the morning with little or almost no bleeding. I changed my diet, drank lot of water, and it used to go and get better in a day or two. But this time it's very severe, doctor, not going even after 2 weeks. And I also can feel a lump near my anal lobe." This is how a typical patient presents in the OPD. The common symptoms, like I have already mentioned, is burning sensation after motions, a visible tear near the anal opening, painful bowel movements, particularly the initial act of motion is very painful, bleeding while passing motions, and in chronic cases, itching in the anal area. How to diagnose a fissure? Simple clinical examination in the outpatient department is sufficient to diagnose anal fissures. Sometimes the doctor may do a rectal examination to know if any other associated pathology like hemorrhoids or fistula is coexisting. Now, what to do when you have anal fissures? Majority of fissures, if superficial, don't require extensive management. The mantra is to avoid excessive rubbing of stool with the ulcer or fissure and allowing it to heal. Common measures which we ask our patients to take is a dietary modification, wherein we ask them to incorporate a high fiber diet with raw fruits and vegetables, if required fiber supplements, plenty of oral fluids. Patients usually are advised stool softeners to prevent constipation and for smooth passage of motions. We prescribe local soothing gels or ointments to be applied around the anal opening before the bowel movements. This prevents rubbing of the stool with the ulcer and promotes faster healing. Warm water bath, or commonly known as sizz bath, wherein a patient is asked to sit in a warm tub of water, which relaxes the anal muscles and increases the blood flow. If the patient has an infection coexisting with the fissure, we prescribe antibiotics and anti-inflammatory to reduce the pain and infection. Acute fissures usually heal with the above measures, but it's the chronic deep fissures with exposure of underlying muscle tissue which usually cause recurrent symptoms and need intervention. Patient typically gives the history of waxing and waning. They have symptoms which reduces with treatment, again only to recur after a period of months. So when do we need a surgical treatment for fissures? Surgical intervention in fissures is indicated for severe symptoms not responding to the conservative care which I mentioned, or recurrent symptoms affecting the day-to-day life of the patient. What we do for surgical treatment of fissures? The procedure is called internal anal sphincterotomy. This is a procedure in which the internal anal sphincter or the anal musculature close to the anal opening is divided at a particular point and the anal dilatation is done. This causes relaxation of anal muscles. As I have already told you, any patient with chronic anal fissures will have very tight anal musculature. So with the sphincterotomy, there is relaxation of anal muscles and improved blood circulation to the fissure site, resulting in healing of the wound. This is usually done along with excision of the fissure or fissurectomy. It can be done using advanced lasers also with minimal pain and post-operative discomfort. It's usually done as a day care procedure and patients usually return to normalcy in 3 to 4 days. Lastly, what I want to emphasize is anal fissures are more to do with our lifestyle and stress. So healthy dietary habits, regular physical exercise go a long way in reducing the occurrence of these issues. That's all for this session. Further information regarding anal fissures, you can check out our website. Thank you everyone for listening to me patiently. I'll catch you up soon with another important topic. This is Dr. Manas Ranjan Tripathi signing off.